County Board of Commissioners. That's a mouthful.
It is, yeah.
Well, good evening, Commissioner Hearn, Chairman Hearn, and Commissioners. Thank you so much for the opportunity to be here tonight. I'm incredibly grateful for the opportunity to lead an amazing nonprofit in Fayette County, and I want to begin by thanking you for this proclamation. As you said, our story began in 2008 with a retired nurse named Ruth McCommon, when Ruth shared with her Sunday school class at First Baptist Church in Peachtree City the need that she saw in our community and believed that something should be done about it. Her church rallied around her vision, and in September 2009, the Healing Bridge Clinic saw its first patient. Since then, our mission has remained simple. It's to provide health care at no charge to uninsured residents of Fayette and surrounding counties who meet those eligibility requirements. But tonight, I'd like to share with you three numbers: 11, 40, and 2,150. And what that means is 11% of Fayette County residents qualify for our services. Over the past 2 years, we've experienced a 40% growth in the demand of our services. And last year alone, 2,150 patients entered our doors looking for something that many of us take for granted: access to health care. Behind every one of those numbers is a person. It's a mother who needs to stay healthy to care for her children. It's a father trying to manage his blood pressure so he can continue to work. It's a neighbor who knows something's wrong and doesn't know where else to turn. These are not people looking for a hand out. They're neighbors that are looking for a hand up. And that need has become even more urgent. With the closing of the Fayette Care Clinic, Healing Bridge now finds itself as the only safety net clinic in the county. Our community has brought us 95 volunteers who give of their time and talents to our mission. Our provider team has grown to 32 medical providers, allowing us to offer, along with from general medicine to specialty ranging from cardiology to orthopedics to behavioral health, physical therapy, and limited vision and dental. We also partner with local nursing schools, giving students the opportunity to experience community-based health care firsthand. So we're not just providing solutions for today, that we are helping prepare healthcare professionals for tomorrow. But we have reached an important moment. Our need is growing, our ability to serve is growing, and the opportunity for our community to respond is here. One of our core values is community, and I believe as commissioners you believe that word is especially important, because it's not simply what happens in the four walls of our clinic, but it's what happens outside those walls. When someone gets their blood pressure under control, everybody benefits. When our parent stays healthy enough to work and care for their family, our community benefits. When we help someone avoid emergency room because they finally have access to primary care, our community benefits. So that's why I'm here tonight. Not simply to tell you about the Healing Bridge Clinic, but to invite you to be part of the solution. We have the volunteers, we have the healthcare professionals, we have the infrastructure, we have the compassion, and we have a growing community that we know how to address. What we need is for our community and your leadership to recognize us that healthcare is simply not a healthcare issue. It's an economic issue, it's a family issue, it's a community issue, and ultimately it's about the kind of community that we want Fayette County to be. Together we can say to our neighbors who are struggling that you are not forgotten, you are not alone, you and your community cares about you. This is what the Healing Bridge Clinic does every day, and tonight I'm asking you to help us do it for even more of the people who call Fayette County home. When we build healthier people, we build healthier families. When we build healthier families, we build a healthier community, and that's worth investing in.
Thank you.
Thanks.
Do you want to, let's do a picture.
Mr. Chair,